Live from WPRI 12. This is Eyewitness News at 11. Coverage you can count on.
My heart sank. It's the worst news a parent can get, that their child can be gravely ill.
A Rhode Island man becomes the fourth American abroad to contract the Ebola virus, and tonight you'll hear what his parents have to say about his condition. The Ebola outbreak hits close to home tonight as a Rhode Island man is now in the fight for his life in Africa. We told you last night an NBC News cameraman overseas had contracted the Ebola virus.
But overnight, we learned that cameraman is from Providence. 33-year-old Ashoka Mukpo's parents tell us he is doing well, all things considered, and on Sunday, he's scheduled to be transported to an isolation unit in Nebraska. Our in-depth coverage continues now at 11.
Eyewitness News reporter Jared Pliner spoke to Mukpo's parents and joins us now live on the east side of Providence with more on how they're dealing with their son's diagnosis.
And Mike and Shannon, in speaking with the experts, as parents say their son's prognosis is good, but it doesn't make this whole ordeal any less unsettling. Providence native 33-year-old Ashoka Mukpo, the latest American to contract Ebola in West Africa. A freelance videographer with NBC News in Liberia, Mukpo was diagnosed this week. His mother Diana on the call that started it all.
My heart sank. It's the worst news a parent can get, that their child can be gravely ill.
As it so happens, Ashoka's father, Dr. Mitchell Levy, is medical director of Rhode Island Hospital's intensive care unit. He also consults for the CDC.
I actually think he's doing a little bit better today than he was yesterday. He still has the early signs and symptoms of Ebola, so he's feverish, he's got some chills, he's got some muscle aches, and he's weak and tired.
Mukpo now set to fly from Monrovia to a medical facility in Nebraska. He should arrive early next week.
He knows he's coming home. And so I think the burden that he was feeling of being isolated and his fear of dying, that hasn't gone away, obviously, completely. But he knows he's coming home and he's going to get good treatment.
We won't actually be able to even look at him through glass. It's going to be on a video cam. But it'll be a month before we can actually see him in person, at least.
Dr. Levy says his son, who has been in Liberia for the past few years, feels a strong connection to its people and was committed to reporting the devastating power of Ebola to the world.
He is a person of fierce integrity and stubborn. And he said to me, I feel like I was trained for this.
And the doctor admits there were times where he thought his son was crazy for wanting to be in the middle of this crisis. Ashoka's parents also realized tonight their son is on track to receive top-notch medical care, which is a far cry from the medical reality on the ground in the hot zone. Live with the Providence Mobile Newsroom tonight, I'm Jared Pliner, Eyewitness News.
Right now, 10 people have been identified as being at high risk of developing Ebola because of close contact they had with Thomas Eric Duncan, America's first diagnosed case of the virus. And we've learned a patient at Howard University Hospital in Washington, D.C. is in isolation for showing signs of the Ebola virus. Now the government is working to contain the virus.
We are not facing just a health crisis. We are facing a national security priority.
At a Friday afternoon briefing, the White House laid out its plan to coordinate national efforts with local authorities to contain the Ebola virus. Lisa Monaco, the assistant to the president for Homeland Security, is heading the federal government's response.
The United States is prepared to deal with this crisis, both at home and in the region. Every Ebola outbreak over the past 40 years has been stopped. We know how to do this, and we will do it again.
Meanwhile, 2 possible Ebola patients are being monitored in the Washington, D.C. area. One at Howard University Hospital, another at a facility in Rockville, Maryland. Officials say both recently traveled to Africa, though so far they have not tested positive for the virus.
We remain focused on working with our partners on the ground to stop the epidemic at its source, and we're continuing to take the necessary precautions across the United States government to prevent the epidemic from spreading further.
The Pentagon said on Friday that the U.S. military could send more troops to the Ebola-afflicted countries, in addition to the 3,000 already committed. And there was another Ebola scare overnight in Georgia when police say a man arrested for DUI complained about being sick, but officials say so far he's tested negative for Ebola. And stay with Eyewitness News and WPRI.com for continuing coverage of the Ebola outbreak. There's extended coverage online right now, including information about symptoms, treatment, and prevention. And our on-air coverage of this story continues tomorrow on Eyewitness News this morning at 6 a.m.